Without further ado, I will start with our first presentations, which is on heritage and volunteering in the whole system's approach to social prescribing, heritage connectors and heritage bodies. These are actually two pilot projects which Historic England commissioned last year. Heritage connectors and heritage bodies, they aimed to test how two established models of a supportive and helping community roles, such as those of the connectors and bodies, could be applied for heritage. I will let our delivery partners, Jenny Hartnoll from Frome Medical Practice and Amanda Chambers from the Nottingham Community and Voluntary Service, to tell you themselves about the work under each of these pilots. And we will also hear from Meg Clark from Wavehill at the end, who led on the evaluation for both projects, and she will share with you findings and recommendations as a result of that work. In one sentence, Heritage Connectors was based on the extremely successful community connectors model that Frome Medical Practice has created quite a few years ago now, based on light touch training of everyday community members in signposting people to social prescribing services in Frome. We wanted to learn from that successful practice how we can adapt that model for heritage, what the steps of creating heritage bodies will be, heritage connectors will be. And we also wanted to understand how this could be potentially scaled up across the country. Heritage bodies, we commissioned Nottingham Community and Voluntary Service to deliver based on their work and experience of delivering the Nature Bodies Programme and Toolkit for Natural England as part of their Green Social Prescribing Programme. The bodies go a step further than the connectors and befriend people in need so that they can find and explore social prescribing activities around them until they grow confident that they can access these and benefit from them independently. I will let Amanda tell you more about what we found around how this model can be adapted for heritage later. But just before we move to my lovely speakers, our teams, to explain a little bit why we decided to invest in those two tiny pilots. In NASP, which is the National Academy of Social Prescribing's understanding of what social prescribing is and how the social prescribing system works, there are three areas of implementation of social prescribing, so to speak. One where people can independently find and access social activities and support services, that kind of a green independent area there. Then we have the middle one in blue there, where people may need some help and support from friends, family, neighbors, or other helpers and connectors through the community. And then the third one in pink over there, where the health-based link workers fit in, who can offer specialist and in-depth support to those with most complex needs. In this scheme, connectors and bodies fit in that second blue circle, as what they do is to help people find and access services and activities confidently. Now, in NASP and their whole community approach to social prescribing, the social prescribing infrastructure works when we have the following 6 elements. We have community hubs where people can find activities and support services, information and access to information about these. We also have social prescribing link workers who are embedded with the healthcare settings in the community, with the training support and networks to reach and support people. We have obviously the connection to services, and this is exactly where connectors and bodies fit. There's these supporting roles to help people access all this. We have a thriving community, which is mainly here, meaning the voluntary and community service sector, who is the hub, the actual provider of all these activities. I mentioned the social prescribing link workers, they just popped on the screen now. Of course, sustainable investment, that's a big one, to allow this, of course, to continue, and for the organizations who provide those services to be able to provide this for the beneficiaries and the people going forward. And of course, we need robust data and evaluation to be able to prove to the health sector that these interventions and activities work, and that it's worthwhile investing in this going forward. So after this little introduction, I will play now a pre-recording of a short presentation about the Heritage Connectors pilot given by Jenny Hartnoll, who is the development lead for Frome's social prescribing service, Health Connections, and she was also the project manager to the Heritage Connectors project. So fingers crossed this will work.
Hello, my name's Jenny Hartnoll, and I'm going to give you a brief 5-minute presentation on the Heritage Connector pilot, which we did in Frome last year, which was a collaboration between Historic England and Health Connections, which is the GP practice, social prescribing and health coaching team, based on the work that we've done over the last 10 years on community connectors, where we've trained over 2,000 community connectors. There are lots of people who know about information around heritage, for example, the Frome History Group, Frome Guided Walks, Frome Tunnels, Weavers and Spinners Group, which is fantastic if people know about it. But there are lots of people who just don't know about it. And if they don't know about those opportunities, they basically don't exist for them. And that's where Heritage Connectors come in. Here's our Heritage Connector, and what do? So Heritage Connectors simply give postcards which have got information of where people can find out information, resources, opportunities to get involved in heritage. So here we have the one side of the postcard, and on the back of the postcard it says the benefits of engaging with heritage. So they give out that postcard, and that postcard then gives them access and knowledge and information about all those things that other person knew about. It's as simple as that. Simple. What does a connector actually do? Well, they signpost friends, family, colleagues, neighbours and strangers to those heritage access points in the community. They only do it if and when they get the opportunity and if they feel like it. There's no pressure whatsoever. So you might have a heritage connector that never signposts anyone at all, and that's fine because they've learned about that information themselves. And you might get a heritage connector who's busy connecting people to those heritage access points all the time. Anyone and everyone can be a heritage connector. We've trained community members and the whole social prescribing team here in Frome, and that was 70 people trained in the pilot. It's not about being a formal volunteer, for example, a befriender or a buddy. It's just a simple signpost that anyone and everyone can do. And the training involves what does heritage mean to you, heritage and wellbeing, linking to those heritage information access points, benefits of being a heritage connector, benefits to the person being connected. 70 community connectors trained in Frome, and we figured out through our other connector project that on average people might speak to 20 people a year. So that's 1,400 people that would potentially find out information about heritage access points that might not otherwise have known about them. So that was a great ripple effect. It's simple training up those people as heritage connectors, but what was involved in actually setting it up in the beginning? Well, first of all, we had to find those things that we call heritage information access points, because we can't possibly tell everyone about everything that's available. We just need to signpost them to places where they can then find out about information that's available. So we brought stakeholders and people in the community together, and it was decided that the Discover Frome, so the town council website, would be the main place of access for that information. And also the telephone of Discover Frome would be places for people who prefer to find out information by the telephone. But what we didn't have was a physical place people could go to. So a heritage cafe was set up as part of the project. So this was kind of bringing people together in the community to collectively decide what those information access points would be. And that's the bit that might take quite a long time, because you do need to bring those people together to agree on those access points. Directory on the Frome Town Council website. So they really built on that during the project, and that was great collaboration between the project here and the Town Council to build up that information on their website. And it also included the heritage and wellbeing benefits on that page too. So as part of the Heritage Connector pilot, we also decided to put some information of heritage opportunities in the pilot area of Frome on our website directory, which is used by all the GP practices in Mendip, which has a practice population of 118,000 and 11 GP practices, and it's used by practice staff and community members alike. So we have the usual things that are on a social prescribing directory, for example, advocacy, mentoring, befriending, bereavement, carers, cancer, diabetes, drugs and alcohol, end of life, exercise, falls, healthy weight, hearing, and we added in this heritage wellbeing category, which hadn't been there previously. So if we click on that, we have the benefits of heritage and wellbeing, which was really interesting having that there at the top of the category, because in the other categories we haven't got that. So that's really informed us to maybe put that on the other categories in the directory. And if you scroll down, we've just got those groups, services, opportunities in Frome to get involved in heritage. And interestingly, if we look at the other areas of Mendip to see what's available there with regards to heritage, just need to take off that Frome. Oh, you click on heritage wellbeing. There's nothing there. And the reason there's nothing there for those areas here, so the Glastonbury, Shepton Mallet, Street and Wells, is because the social prescribing team haven't yet put those opportunities on the website. So it's a real prompt for us as a service that covers lots of different areas to not just think about that in the pilot area, but to think about that and add those things into other areas that we cover, but also to train the team up as heritage connectors so they can, the rest of the team that's out of Frome, so they can be aware of all the benefits for connecting to heritage for themselves and their community and for the people they support. Right. Initially, we sort of brought those community groups together to decide on the heritage information access points. The website was already there in existence and the phone line was, but we just need to build up the information on the website. We built new access points because we needed to have that many ways to many, that people receive information in different ways. So we had the website, phone line, we needed that physical place. So that Heritage Cafe was set up as part of the project. The trainer trained 70 heritage connectors, of including the social prescribing team, and the training content with an impact. So I think the training content changed people's perceptions of what heritage was and linked people through to the understanding of the benefits between heritage and wellbeing, especially within our social prescribing team. So they might not necessarily have thought of heritage as something of signposting people to in the past, but it has built that in. And there's unexpected consequences that heritage is embedded now in the social prescribing work. And also it influences how we explain other areas of social prescribing. And that was kind of when we added in that benefits of heritage. So we're thinking of adding that into other categories on our website. So it's not just about training up those 70 heritage connectors. It's about bringing the community together and those ripple effects. Thank you very much. And just to mention that the Connector Toolkit is going to launch at a NAS webinar on May the 1st with heritage connectors as a case study. Thank you very much.
Thank you, Jenny. And as Jenny said, we're going to have a webinar on heritage on community connectors, where the heritage connectors are one example, and we'll launch the toolkit as well with case study of heritage connectors on the 1st of May. And if you go on NASP's website, soon you'll be able to book yourself for that webinar. Jenny will also be available at the end for Q&A live. So if you have a question about that project. So I'm really pleased now to go and have Amanda Chambers talking, who is our Health and Wellbeing Manager from Nottingham Community Voluntary Service. She was also the project manager for Heritage Buddies in Nottingham, and she will have an opportunity now to tell you a little bit more about the work on this pilot. I'll just come out of the slides just for a second so I can welcome Amanda on Teams, just to check that we can hear her. Hi, Amanda.
Hi, Desi. Hi, everybody.
Wonderful. Okay, so I'll minimize you again, Amanda, and I will share your slides. Like I said, I will. Just a second. Oh, okay. Sorry. Click the wrong thing. Here we go. Okay, Amanda, off you go. Thank you.
Thank you, Desi, and good morning to everyone. And thanks, Desi, for this opportunity to talk about the work we did in Nottingham. As Desi has introduced me, I'm Amanda Chambers. I'm the Health and Wellbeing Programme Manager for Nottingham CVS. And I led the Green Social Prescribing Green Space programme across both the city and the county. And we did a piece of work around nature buddies. And it was really about taking the learning from that and looking at how do we move that into a different sector, what needs to change, what's different, what's similar. So I'm going to talk very briefly about our approach, who we worked with, the pathways we developed with our partners, and some key learning points, and how you can find out more and read more and learn more in detail about the work that we did. So if I can have the next slide, please, Desi. Thank you. So this is our partnership in Nottingham. We had approximately 9 months to deliver this programme, and a lot of the time at the beginning of that was spent engaging in the heritage sector and with our health partners to understand how heritage buddies could work for them, and also to explain to them what a heritage buddy is and how they could work with us and be one of our partners. So heritage organisations, we work with a couple of key organisations in the city and just outside the city. And with those heritage organisations, we worked with their volunteer lead and either their existing volunteers, or in the case of the National Justice Museum, with volunteers that they were recruiting. So for Newstead Abbey and Nottingham Castle, they had existing volunteers who were interested in effectively putting a buddying hat on and supporting people to visit their site. For the National Justice Museum, they were interested in building the concept of buddying into their new volunteering programme. And similar for York Archaeology Project, they were interested in offering opportunities for people to come along, volunteer, and to support them through buddying to take part. We also engage with befriending and community organisations, and one of the reasons for this was one of the key aims of the Heritage Buddies programme was to look at improving the diversity of both volunteers and visitors to the heritage assets. And so we worked with a number of befriending and community organisations that you can see there that typically would not consider visiting a heritage asset as something that they might choose to do or had done previously, or perceive that there were a number of barriers in the way for them doing this. So perhaps it was not something that they felt was for them. And we wanted to work with these befriending and community organisations to encourage their befrienders to act as heritage buddies, to support the clients and the members that they work with to access heritage assets, heritage activities, and open up those new opportunities for them, but equally take new visitors to those heritage assets. We worked with health, so looking at the links between social prescribing link workers, so people who work with patients who have a number of physical, emotional, social needs that can't be dealt with by medication, but by referring them into community-based activities can have a considerable impact on their health and well-being. So looking at how social prescribing link workers could, through Heritage Buddies, support their patients to access heritage assets and activities. Now, when we were putting this partnership together, we engaged with a whole range of heritage organisations in the city, and we've listed some of those under destinations. Those organisations did not at the time have the capacity to actually get involved in the full Heritage Buddies programme, but what they were willing to be was destinations for Heritage Buddies to take the people they were working with, the participants, to their activities. And they saw this as a really positive way and a new way of reaching new audiences. And I've just listed there our steering group as well. So you can see that we brought together representatives from each of those different groups of partners as our steering group, which met on a 2-weekly basis. Have the next slide, please, Desi. So this really looks at the models that we developed. And I think the key thing is about this, buddying is really about supporting effective referrals. For an individual, getting a social prescription, getting a referral is only part of the journey and is only the start of the journey. And there can be many barriers to them taking part in an activity. And in this case, in visiting a heritage activity, particularly if it's something they've not done before, if they feel that they don't want to go on their own, if it's not something that is in their culture or their practice. So those barriers can mean that that referral is not effective and doesn't take place. So a buddy is very much an enabler, a supporter to ensuring that that social prescription, that referral, is much more likely to be effective. So we co-produced a range of different pathways with our partners, where you can see on this model, the little Heritage Buddies image, the little icon there, is really coming in and supporting those individuals, whether they are coming through a befriending or community organisation, or whether they're coming through a GP or through a link worker, or actually also whether they are referring themselves. There's still a role for Heritage Buddies and self-referrals. So that Heritage Buddy is really key in making that referral, that social prescription actually happen, be effective. If you just imagine yourself taking part in something that's new or going somewhere that you've not been before, often you would try and encourage a family member or a friend to go with you. For an individual, for a patient, for an individual that has high levels of anxiety, is socially isolated, potentially has mobility problems, or is just not aware of the opportunities that are out there, they need that hand-holding to help them take part, to build their confidence. So buddying is a really positive enabler to supporting social prescribing and referral pathways and opening up those heritage assets and those heritage activities to new audiences who may not access them or enjoy them or get the benefits from them for their health and well-being without that buddying role. Could I have the next slide, please, Desi? And these are just a few of the lessons that we learnt when we were developing a Heritage Buddies scheme in Nottingham. There is a full report which has been made public with all of our learning in it, but I just wanted to pick out a few key things. The concept of Heritage Buddies is relatively straightforward. When you try and put it into practice, it does become more complex. But we found the way to overcome that was very much a co-production approach, really working with the different organisations, getting a clear understanding of what a buddy role means for them. And so each organisation develops their approach to buddying so that it works for them and so they can really embrace it. Through the buddying, we encourage community outreach, activity and networking, particularly bridging the gap between health and those heritage providers and encouraging them to meet. So an example of that would be inviting a heritage organisation, a volunteer lead from an organisation or a buddy to go to a coffee morning organised by a social prescribing link worker. It was all about building relationships, building connections, outreach, and rather than just saying we're here, come to us, is actually going out and doing that outreach work. Being really clear and communicating how heritage activities can contribute to health and well-being, talking about the benefits for your social connectedness, for your mental health, for your physical health, and that overall community well-being. And the benefit of doing this is it really helps to bring different partners on board. It really helps them to see the benefits of them being involved in a Heritage Buddies scheme, and not to assume that people realise what this is, but to clearly define and communicate it. It's really important to fully involve the volunteer leads and the volunteers from the heritage organisations in the design and the development of the scheme, because this helps build sustainability. So we made sure, as we were training the volunteers to be Heritage Buddies, that the volunteer leads were involved in that training, that they helped us design it, so that going forwards they can deliver it themselves to new volunteers joining the organisation. So they take ownership of that buddy scheme, and they're driving and developing that buddy scheme within their heritage organisation. And finally, that a single model approach really doesn't work for all organisations. We had to be very flexible and respond to what we were hearing and what we were learning through this project. And Desi allowed us to do that, to be flexible, to take an action research approach, to start with a theory around a single model approach, and then really to explore that and develop that as we talk to the different organisations. And my final slide, please, Desi. And just to finish off with this, is that I mentioned before there is a final report which is we've made public around our learning, which goes into some of the things I've talked about in much more detail. But most importantly, there's a Heritage Buddies Toolkit, which provides a step-by-step example, step-by-step process to developing a Heritage Buddies scheme. It's got lots of our learning in there. It gives guidance on how to do it. And hopefully that would be a really useful toolkit for anyone thinking about developing a Heritage Buddies scheme. So that's all I've got to say, Desi. I'm going to hand back to you, and hopefully that's given you a little snapshot of what we did in Nottingham, and I can answer any questions later when we get to a Q&A.
Thank you very much, Amanda. That was brilliant. Thanks. And like Amanda said, we have the Heritage Buddies Toolkit on Historic England's website and on NASP's website as well. And if you go to NASP's website as well and look at their webinars, there is a recorded webinar on nature and heritage bodies, which we did together with Natural England at the end of February. So you can watch that as well and find a little bit more about both types of bodies and all the work that Amanda was involved in as well. And we're also going to add on our website the Heritage Connectors case study and the Community Connector Toolkit later in May after the other webinar that I mentioned. Amanda, Jenny, thank you very much. I will actually leave the Teams meeting as it is now because I have to use my computer for the other presentations in a moment. We haven't finished with ours, just 1 second. But thank you very much, and we'll rejoin with you for the Q&A. Okay, so thank you. I'll just leave that because the little screen pops up when other people are presenting. However, bear with us a little bit more because it's time to share. Oh my God, I'll start again from the beginning, sorry. I would like to share now with you some of the findings from the evaluation report, very kindly done by Wavehill, and Meg Clark, my colleague, will be here just to, I guess that's from the beginning. Some of these findings, just a second. Technology is not our friend today, but we'll persevere. Here we go. You can see that. Over to you.
Thanks. Thank you very much. Oh, goodness. Hello, my name is Megan Clark. I'm a researcher at Wavehill, and we were fortunate enough to do the evaluation for both the Buddies and the Connectors schemes together in parallel. So obviously we've learned already some of the findings from each of the schemes specifically, but for us it was to look at the big picture and how it was done in practice sort of overall, how it was led through Historic England as we were commissioned by Historic England in the round. For us, the sort of take-home message, really, because I appreciate we haven't got a huge amount of time, the take-home message is that both the schemes met their core objectives, and that was to test how the heritage sector could contribute to social prescribing. I realise that's the reason we're here today, but both schemes did that, which was fantastic. There was lots of specific learning about that, how that could be designed in practice in the future, how that could be resourced, and that piece that we hear so much about of evidencing kind of what works. There is plenty of that. There's that in spades for both models. As you've heard, the models are very different, but obviously threads running through them. So for us, we've taken learning across the two and the separate learnings as well there. You'll see on this rather busy slide our methodology. I won't read it all out for you, but we took a mixed methods approach to our research. Interviews, site visits. I was fortunate enough to go down to the William Booth Museum in Nottingham, which was a great day, but lots of involved across the whole the year itself. For the successes then, so on the process evaluation side of things, both schemes took an iterative approach, as Amanda said just there, lessons learned as they went, because really it was putting into practice these concepts. putting into practice these lessons learned and generating that into the toolkits, which will be those legacy pieces for the sector going forwards. In terms of the outcomes, whilst they weren't about ticking boxes by any stretch, both did train a lot of people, train lots of buddies and train lots of connectors, and the ripple effects there will be positive. So as Jenny says, as Amanda says, 32 buddies, and Jenny says 70 connectors. Those numbers are about what we'd expect for the schemes, considering the models and how they work in practice and what the training looks like. But it was fantastic to get that many people trained in the time that they had. And then, of course, the understanding that was generated through it. As you'll see here, increased understanding of the links between heritage and wellbeing locally. That was evidenced in both of the sites, in both locations. Both indicated that the potential that on an individual and on a community level, that would contribute to wellbeing. And just the key success for both of them of embedding heritage in a social prescribing pathway. It wouldn't be an evaluation without challenges, wouldn't be projects without challenges. And the top one, I mean, Taylor's Old as Time, that time is one of the biggest challenges. Both were 9-month projects, which were extended out to a year. And as ever, that's just not quite enough time to build those relationships, to develop these concepts into practice. And particularly with the number of organisations involved. You know, we all know that VTSE organisations in particular are incredibly low on capacity. So the time to do that in a meaningful way and engage with communities in a meaningful way, I think for us, that's the key, as well as in evaluators, the time to collect data, meaningful data that shows distance travelled is always hard over the course of a year. Added to that, the heritage aspect of the seasonality, which I won't need to say to anyone involved in nature in the room, but the same obviously applies to heritage. The kind of the flows of how that looks throughout the year has a massive impact on it. I'll skip over a little bit, but the last 3 points here around specifically how heritage has worked in this practice. For some people, it was just seen as too niche or not as a priority when meeting high-level needs. That was the feedback that some gave. That didn't mean it wasn't useful or valuable, but just something to consider when putting this into practice in the future. Negative perceptions of heritage, and again, barriers to accessing heritage, which I'll come on to in our recommendations. I'll jump through these quickly, but that top point there on addressing barriers to accessing heritage as a priority before commissioning any of this work, mapping out, understanding the barriers, and then addressing them before putting any commissions in place was incredibly important. That included, you know, transport barriers, cost barriers, physical access barriers, and even just the fact that it can be quite intimidating for some people. You know, it's really understanding what that looks like in practice in those locations was some successes and also some challenges for both the schemes. I won't go through all of them because, as ever, funding, staff capacity, resources, I don't need to explain those. But the second to last point here, adopting a flexible approach to suit local needs and conditions. If anyone that's visited Nottingham or Frome, you'll know they're incredibly different places. Frome, a market town in Somerset, Nottingham, a very diverse and thriving city. The heritage provision in both those locations, really different. The social prescribing infrastructure, incredibly different in practice. So for scaling up either of these schemes in the future, putting that into practice, that mapping exercise was incredibly important, and took that. This phrase is trotted out many times, the place-based approach, but it couldn't be truer in these cases. And just to say thanks to Amanda and Jenny for supporting with our evaluation, our data collection. Thanks so much, Desi, as well, for your flexibility and support throughout. It's been brilliant to be involved with. Thank you very much.